Shanna Palmieri, and I'm a licensed clinical social worker. I've spent the last 20 plus years working in mental health and child and family services and emergency psychiatry services. Over the recent years, there's been a significant crisis when it comes to crisis mental health treatment and access to care for children and adolescents. We've seen dramatic increases, sometimes 200 to 400% of children and adolescents going to the emergency department when they're in crisis. The situation is exacerbated by long waits in the emergency department for children and adolescents. And this experience for a child and an adolescent and for their family, it's very tragic when they have a crisis. They're going to get crisis care during this time period, and they end up in the emergency department. And then what ends up being an extraordinarily long wait in an environment that is not designed to hold anybody for longer than a couple of hours.
My name is Casey Childers, and I am the Director of Business Development for Caris Behavioral Hospital. I've heard the horror stories of it taking weeks, months to even find a bed for some patients. And in that time frame, they are stuck in the ER, taking up space in the emergency room. The nurses are having to check on them. Sometimes the kid is in the ER so long, the crisis has subsided and they're no longer suicidal. So now they, even though they attempted suicide last week, now they're no longer meeting inpatient criteria because the crisis has subsided. So it's important whenever the kid is having a crisis to get them somewhere fast.
The overall mission and purpose of Transferall being designed and developed and deployed out into the market of healthcare professionals was exactly for this problem. Transferall took a manual-based process and worked to put together a behavioral health transfer network of every potential resource, an order of distance away to find the closest, most quality program for each patient in a very short period of time. We've expedited the process through an automated digital transfer process, eliminating manual phone calls and faxing. As a result, what we see is dramatic decreases in the amount of time that it takes to find an appropriate placement for a child or adolescent. We look at an average placement time in about an hour now, as compared to prior to Transferall. Our customers were reporting it was taking them on average at least 8 hours for the typical patient. No child or adolescent should be in an emergency department more than a few hours.